Hello, everyone. I'm Dr. Janet Courtney, and I am here with Ashley Lingerfelt. And we are going to be talking today, just real briefly, about a chapter that she wrote. Actually, we co-authored the chapter together with the title, Tiny Hearts and Hands. Nature sensory play promotes infant mental health. I was so honored to write that chapter with you. And I would like for you just to share a little bit about your experience of that chapter, where you're from, and also maybe some of your interventions that you created that for that chapter.
Yeah, of course. Well, first, thank you for having me, and thank you for talking with me about this chapter. It was such an honor to be, invited to co-author this chapter with you. So yes, my name is Ashley Lingerfelt, and I am actually based in Georgia. I am a licensed professional counselor with a specialty in infant, early childhood, and perinatal mental health. So I have my own private practice, and I focus on helping families pregnancy through the first 6 years of life predominantly. And so I was very excited whenever I heard that you were doing this book and you invited me to talk about infant mental health, because that's something I'm very, very passionate about. My specific interventions, really, I wanted to focus on a few core themes that I see caregivers wanting support with or needing to strengthen in their relationship with their young child. I focused on co-regulation, engagement, and allowing appropriate risk-taking, safe risk-taking. And so which obviously in nature, there are so many opportunities for that. And yeah, I did a case study following a mother and her infant daughter. So
it's a really engaging case study. And I like how you set it up to where you kind of slowly introduced, you have like 4 different interventions that you provide and offer and invite this mother with her infant to engage in. And so you would explain it, and then she would go out and kind of practice it, which we always love when we give homework and then our clients do actually practice and come back and share with us, how that worked for them. So, and then you would offer another nature intervention, and it was very profound.
Oh, thank you for saying that. Yeah.
Right.
So kind of to give you an idea, it starts off by screening and assessing the mother and the child, the dyad, for whatever for areas that they may need support in, right? And also looking at perinatal mood and anxiety disorders for the mother, and making sure that she was receiving the proper support. And then after the initial assessment, I created some interventions that the mother could practice with her daughter at home or at a local park, as you'll learn, as anyone who reads the chapter will see. And then coming back and reassessing for progress. But the interventions are very accessible. They're very easy to use, but they're also very impactful, which is, what we want to go for when we're supporting relational work with young children and their caregivers. We want the work to be impactful, but also accessible. So that's what I was going for.
I like that, impactful and accessible. That's a good way to think about it. So listen, I'm so honored that you could be a part of this book, Nature-Based Play and Expressive Therapies. And if somebody wanted to get in touch with you, how can they do that? How can they reach you?
Yeah. So the best way is to go to my website, which is www.playtimetherapy.org.
Oh, I like that. Playtimetherapy.org. Wonderful.
Yeah.
Okay. Well, listen, thank you so much for being part of this interview time today. And I just know you as a person, and I just really appreciate all the good work that you are doing, especially in the field of infant mental health. And so again, if anybody would like to reach out to you and have any questions for you, then I think that you offered the way to do that. Okay, so we will say goodbye, and thank you everybody for listening. Thank you.
Bye.